So our panelists today are Dr. Nigila Ravichandran. She's a consultant psychiatrist at Institute of Mental Health in Singapore. Sharmini Ramachandran, she's a senior counselor. And Sujata, whose name has been changed on request, and she is, we'll only hear her audio. She is living with depression, and I am Aparna, the moderator.
A lot of people do not understand depression. It's very, very common for us to hear people say, I'm feeling depressed, I'm feeling sad. So most often people equate these two. But if you look at it more deeply, if you look at it from a very clinical or medical point of view, there is a lot of difference. Feeling sad, feeling down once in a while is quite common for all of us as humans. There are days we don't feel that good. There are days when you don't feel like getting out of your bed and going ahead with your daily routine, your daily tasks, even going to work. But this happens maybe lasts you like a few minutes, maybe even a few hours, or maybe the whole day. But you are up and about the next day and you're going about your daily activities. But when you're talking about depression, this kind of sadness, this kind of feeling low, the mood which we describe is low, continues to kind of engulf you for the next few days. It's like typically for a depression to be diagnosed, we want it to be going on at least for a minimum of 2 weeks. Sometimes it can be even shorter when the severity is more, but generally we take it as a guideline that it has been going on for at least 2 weeks, and there are not much breaks in between. You may be still carrying on your daily activities, but not with the same gusto and the enthusiasm which you have been displaying before. And
Right.
together with that, you start losing interest in things. You might have been like an avid TV watcher, you stop watching. You may be like a singer or a musician, or you may even be a listener to music. You stop listening to music. You may stop meeting out, going out with friends. You may start avoiding friends. You may be a sports person. You stop playing sports. And I mean, I'm just naming some of the examples of interest areas that it could be like a number of interest areas which people stop showing interest in. So that these are the two main criteria which we use in our clinical settings to diagnose depression. But it does not stop there. Because of this, or as a result of this, or maybe sometimes as a trigger, there can be other symptoms or signs, as we call them, like there can be sleep disturbances. So most commonly what we hear is people having lack of sleep or unable to sleep or difficulty initiating or sustaining the sleep through the night. And classically it is described as the person who tends to sleep until morning, wakes up very early and does not know what to do after that. So and in some cases you can have, in some people you can have the sleep becoming too much. They sleep the whole day because they have nothing else to do. They feel very listless. Then they start feeling that they start feeling helpless. They start feeling hopeless. There is no hope in everything. People around them talk about things, nice things happening around. They're not interested in listening. So they start talking about all the negative things, all the hopeless things, all those things that happened in the past or could be happening in the future or even in the present. Even the very minor, trivial things become very big for them. This becomes a reason for their hopelessness, and they start feeling helpless about it. They don't know how to manage it. They don't know how to handle the situation. They don't know how to come out of this and do things better. Then their appetite goes down because you're slowly losing interest in everything. So the appetite starts going down, weight starts going down. The person becomes like notices that they are not able to concentrate on things which they were able to do very well on. Like for example, at work, the person who was able to finish tasks given to them is like slowing down or is slowing other people down, becomes noticeable to people around them, to their supervisors, even to family members. Then there are some people start displaying some kind of irritability. They are like finding fault with people or very snappy and angry and irritable most of the time. And they become, again, because of the helplessness or because of this anger issues they may have, they start crying more, they become more reclusive, they may stop talking to people, then they become like they notice that their energy level is going down. And in some cases, it goes to the extreme where they not in some, it can be quite a lot of people, they become very suicidal because they are losing hope in everything. They think there's nothing going forward for them. So they
Right.
become suicidal. Sometimes they have actually attempted suicide before they come seeking help. So these are the main things which are taken into consideration when we are diagnosing depression. But for a clinical setting, we take into consideration some of the factors, some of the features, and we are able to come to a conclusion that this person could be possibly depressed. And we
Right.
initiate the right management for them.
Yeah. So the initial symptoms that I faced were primarily a lot of anxiety at work. When I was at work, there was a lot of anxiety. There was lack of sleep. I couldn't sleep until late at night, and I would wake up very early, and I couldn't go back to sleep. Then, as Dr. Nigla said, it was difficult to focus on the routine tasks, which I used to finish on time at work, were getting, affected. There was a loss of appetite. I couldn't eat much. And the whole day, I used to feel a lot of fatigue and lack of energy. So I actually kind of ignored all this for a while, and I said, I'll exercise, I will do some meditation or do something, and it'll be fine. But one fine day, I totally broke down and I thought I need help. And that was when my family was totally unaware of it, and they thought that I'm totally okay because I was carrying on somehow with my day to day tasks. And then I just one day went to the GP and
Hmm.
I told the GP, boss, I have depression. I need to be treated.
Hmm.
So the GP was very shocked. He said, how do you know that you have depression? Let me check you first. So
Hmm.
when I told him about all my symptoms, he said that you're right. And I think I need to refer you to a specialist. And
Hmm.
that's when I started seeing the specialist. And, that's how it all started for me.
I think Sujata's option of going to the GP was the right one, was one of the right options.
Hmm.
Thanks, Sujata. And there are other options. You can actually go to, I mean, I'm talking from the perspective of the Singapore's scenario.
Right.
We have
Right.
several options in Singapore. We have a lot of counseling centers, we have family service centers, we have social service organizations. So there are people who are in touch with these organizations. These are people, if they have already been in touch with these organizations, they can actually seek the advice of the counselor and tell them, see, I've been feeling this way for some time now. I think I may be, I mean, Sujata was right on. She was like on the spot, she got it. And she was able to tell that she was going through depression. But
Hmm.
there are people who may not know that, people who may not be like able to Google and understand, or maybe may not even have like heard of such terms. So these people, they say that I notice that of late I have not been able to do my work as I used to do before, and I'm getting a lot
Hmm.
of complaints from my boss. I may be at a risk of losing my job. So the counselors can actually guide them to the right um,
Right.
places to help. So that may be one option. There are social service organizations which there are people who are quite good at picking up these symptoms and signs and directing these people to the right help. People can go on their own to their own doctors. Like if you have a primary doctor, you have a family doctor, or you have a general practitioner, you can go to them, like what Sujata did. You can go to the primary health care centers, which are the polyclinics in Singapore. You can actually go
Right.
to polyclinics, any polyclinic in Singapore. Preferably, usually, I think people like to go to the ones nearest to their home. You can go
Hmm.
to the general practitioners, the family physicians there. They can do the initial assessment. And if the condition is treatable by them, they usually start and initiate the treatment on their own. And some of the polyclinics even have psychologists, so they are able to provide additional help, medications plus the additional help from psychologists. And if the polyclinic doctor decides this condition needs to be treated by a more specialized center, then they get referred to by default, it is Institute of Mental Health, but there are other hospitals in Singapore. All the other hospitals in Singapore have psychiatry departments, so they get referred to different places depending on the proximity of the person's home to the place or the person's preferences, or if they have no preferences, they get directed to IMH, the Institute of
Right.
Mental Health.
Right.
They get the assessment there and they get the treatment from there.
Okay. Shamini, would you like to add anything from, you work with a family service center. So is there anything you would like to add to this?
There are several agencies available in Singapore for you to tap on. But the ones that usually folks are introduced to or advised to go to are the family service centers. There are 47 of them all around this country, and they are quite accessible, being that they are at the void deck areas of the precincts of the community. So and more importantly, it's free of charge. So when you do go in there and you do get an assessment done, and all of the workers there are trained either in social work, psychology, or counselling, and they've gotten their credentials and whatnot. So there are times where folks will think that, oh, these are just volunteers and they're not going to be very effective. I'm going to say volunteers are quite effective as well. But all of those folks who go into the family service center have gotten these credentials to be able to assess and help out the community. And again, where we are not able to, then we will do the referrals to the right agencies and follow through with the person. We don't just leave them in the lurch kind of a thing. So we'll follow through, ensure they get the help, and then we'll close the situation. But our doors are always open for them to come back in anytime if they feel like it. One of the things about the family service centers is we work complementing the work of institutions like IMH or the other hospitals that have the psychiatric or psychological units. So we don't see each other as outdoing or outshining one another, but it's pretty much a complementing one another and supporting one another in the work. Because there are some folks who do not want to take medication. If it's deemed relevant to take, they rather do the talk therapy. And so on our side, we don't administer any kind of medication. We do the talk therapy. And in some instances, we do group work as well. So we have folks who may be going through the same situation and they'll feel supported when they come in a group, so they know that, hey, I'm not the only one, going through this downtime in my life. I've got other people and I'm learning how to cope from there. So that's been an added advantage as well.
So when I went to the GP and he referred me to the specialist heard my story and told me that I need medication. And as you know, we all have a stigma, about medication. So I told the doctor, give me 2 weeks. I will work on myself. And if I still feel unwell, I will come to take medication. So I started doing yoga. I started running. I started doing brisk walks, nature walks, all sorts of things. And I did start to improve because I took a leave of absence from my work. And I did start to improve for a couple of months, and I was totally normal. But the triggers, as you say, some triggers at family and at home made it more difficult for me to just be on the supports other than medication. And that's when, I decided to go in for medication. One of my aunties is a counselor, and she told my mother also that it is the right time for Ragini to go for medication, because if she doesn't take medication, it will just be really a very stormy path for her. And I was a bit skeptical about medication initially, as we all are, but I think medication played a very important role in my recovery. And that, I think when you're depressed and when you're so down, you really need medication to bring you up at a level where you can do other things like yoga, exercise, meditation, all of those things. Because if you're so unwell, even if you love to meditate, you love to read, as Dr. Nigila said, you will lose all interest and the fatigue levels will be so high that you wouldn't be able to concentrate on anything. You would just feel like so low all the time. So
Right.
slowly, when I started to take medication, with that, I started to recover, and I started getting my interest back in my meditations, in my studies, in yoga. I did a lot of physical exercise. My hobbies of gardening, music, and reading came back to me. And just recently, I got a certificate in speech and drama from NAFA, which was a very good achievement, a very encouraging one for me. So I think medication was the main pillar that was holding me. And apart from that, of course, I took counseling services from Club2Care. Thanks a lot for that. They were a big support in terms of providing support to me in that very grave situation I was in. And I think that's medication, counseling, and all these things that I've mentioned helped me to recover and face the situation in a better way.
I think Sujata took the route of trial and error. I'm not faulting her for that. I think generally there is a kind of resistance and reluctance to go for medications and treatment for depression because we still haven't got out of the stigma and taboo of mental illness itself. But if you look at it like if I'm doing this to make my life better, then it becomes easier to go for whatever kind of help you're going to get. So if you get to the doctor level or if you go to the specialist level, you will definitely be given the option of medications. You will be usually given the option of medications together combined with talk therapy, as it is called, with the psychological help. So there will be therapy and medications. In combination, we have a lot of evidence based to say that this is the best kind of help that can be given to a person with depression. But there are people who opt for either one of them. So there are people who only opt for medications, or there are people who only opt for therapy. The people who opt for medications are doing so because they can't afford the time and they can't commit to the time of going for therapy because usually therapy sessions are pretty long and they are timed and they have to meet the therapist on time and get it done. And it usually goes in the initial phases, it can be twice a week or once a week, and slowly the frequency gets less. But for those who don't like medications, this may be an option. And those who are able to commit to it may be an option. For those who don't want therapy, medications are the best option. If you ask
Right.
me as a doctor, as a medical person, I'll say medications are the best option. But in addition to it, I would call all other methods, all other techniques which we use as adjuncts or additional measures to use. Like you can use yoga, meditation, you can use exercise. Exercise is known to, again, exercise has shown a lot of evidence to show that it is one of the good ways to keep your depression down because it brings on what is known as the good hormones, your good chemicals to come up in your body, and they help you.
Right.
They bring up your anxiety. They actually help you sleep better because they make you tired the healthy way, etc. You can divert your attention or focus your attention on things like music, dance, meeting up people, helping out, volunteering, and like even like going to meet up, like maybe long lost friends, long lost relatives, etc. So these are maybe some of the other options which you can use. But if you ask, the mainstay of treatment for depression will be medications together with therapy.
Right.
Depression and anxiety can go hand in hand, though they are actually separate entities. But what happens is a person who's depressed can be anxious. A person who's anxious can become depressed. So we talked about depression. I think we have given a lot of details, so I won't go into it. When we're talking about anxiety, it's like in a nutshell, in a very simple way, I can put it that you worry. You worry about
Right.
almost everything. You worry about small things, you worry about big things, you worry about other people, you worry about yourself, you worry about health, you worry about how the world is going, whatever is going. So this is general worry, right? when it becomes an anxiety disorder is like this kind of worries. It can be, anxiety is like a very, very, very big term, very general term. Anxiety
Right.
can happen to anybody for that matter, any age group. Even babies can become anxious. But
Right.
when it becomes a disorder, when it starts interfering in your life, when it
Hmm.
starts affecting your daily function, your routine, daily routine, it has some inroads into your life, like it starts affecting the way you do your work, again, like depression. It can start interfering in how you interact with people because you become too intrusive in somebody's activities, or you sort of take a back seat and you don't do your work because you're very anxious. It starts interfering in the way you interact with your friends, with your other extended family members, or maybe even strangers, and it
Hmm.
gets to the point that you can't do anything because your anxiety is kind of disabling you, freezing you. So
Right.
that is the difference between anxiety and depression. But commonly what happens is a person who's anxious can become depressed because they are again feeling helpless there, and a person
Right.
who's depressed can feel anxious because they do not know where they are headed. Again,
Hmm.
that common point there could be that helplessness. Yeah. Yes, a person who is going through grief can develop depression. So maybe I should go a little into the technicalities of how we classify this. When a person has lost somebody, when some person is going through bereavement, we go through a few stages. So there is this initial phase when you're in shock, when you're not trying to accept that this person is really lost, especially when it happens suddenly, or sometimes
Hmm.
even when you're really prepared, you can't really accept it that this person has left you. Then you are slowly coming to terms with it. Then you start imagining your life with the person, without the person. Then you slowly, maybe sometimes you even feel the presence of the person together with you, and then you slowly come to that stage of acceptance. So this is the normal phase of bereavement, the stages which we go through when somebody is lost. And
Hmm.
this is perfectly normal. This is a perfectly natural course of action. But there are some people who have not really like come to terms with the loss of the person. So they
Hmm.
continue to have this pervasive emptiness around them. That gap is not filled. The void is not filled for them, and they continue to remember the person. We know what we say is that the person actually keeps all the belongings of the person. The person keeps
Right.
all the property of the person, and they even sometimes keep a room to remember this person. You might have watched in movies where a whole room is dedicated to this person's memory. To have a memory of the person is good, but sometimes you have all the closets and everything not cleaned, not removed, and everything is kept of this person. And this can go on also. This is one category of people. But there are some who have never really got over it, and they go on. Usually, we take a period of about 6 months to say that if the person has not really gotten over the loss and has not moved on in life, has not gone back to routine life, where has gone through depression. So I'll just bring an example here. I had a person who was living with grandparents for a long time because the parents, I'm not going to mention the gender here, the parents were like kind of away for most part of the person's life, and I think they were divorced. So the person grew up with grandparents and was very close to the grandfather. So they had
Hmm.
they had a lot of sharing time, etc. And the grandfather suddenly died from a heart attack. So the person went through all the initial phases of bereavement and did not really get over the grandfather's loss because the grandmother was also going through her own illness and she developed dementia at a later part of her life. So by the time the grandmother's illness was diagnosed, it was about 4 months post uh, demise of the grandfather. The person never really got out of it when started thinking about the person. It's the rumination, like never
Hmm.
forgot the grandfather, continued to think, lost the job or refused to go back to work, started taking very bad care of themselves, meaning that they were not bathing regularly, they were not changing, they were in the pretext of looking after the grandmother, they were actually neglecting themselves.
Right.
And at some point in time, this really got out of hand. Fortunately, the person realized that something was not really okay. So the person came seeking help and was diagnosed to have depression and was started on treatment. And I'm happy to say that this person is now much, much better. Yeah.
Good, good. Shamini, does the FSC or other are there other options for grief counseling? Because what we found is that grief counseling is a bit more specialized than regular counseling and therapy.
Right. It's a very fair question, and I'd like to also share with the person who posted the question to us, our deepest hope for you to continue helping your friend. Thanks for asking that question on behalf of your friend. The FSCs do have staff who are able to manage grief. I think we also ensure that when we do put someone to work, we check out issues of language, gender, maturity, age and whatnot before we assign the person, the therapist to the client, and someone who may themselves have gone through a process of grief themselves, maybe having someone who have passed on in the family and how they dealt with it. So not necessarily that we would disclose that we went through it ourselves, but we would understand that, and that's where the empathy comes out as well. That saying that we understand where you're coming from in this regard. But as Dr. Nagila has shared, there have been some folks who are not able to manage that detachment issue, and we've needed to refer them to the psychiatrist, or to even get family members to come in and help us work with that entire family system, as we call it, to see whether or not we can approach it from a more holistic point of view rather than just one-on-one. Of course, with permission of the client as well.
Right.
One of the things we do as well when we work with our clients on issues of grief and whatnot is to prepare them for the next individual who may leave them, and say, what would you now want to do that, because there are going to be other people in your family, in your friend circle, who may also leave you, or in some way or other. A grief, I mean, it doesn't need to be a passing on situation. It could be someone even just leaving jobs, and we have colleagues who say, I can't believe my colleague is leaving me and going to another job, and that
Right.
good true for that as well. So we also work on preparing them, and that has helped a little bit when they say, okay, now I can put in these mechanisms to cope, and so this is going to help me in the long run and be better about it as well.
A person who's negative about everything can be kind of the generally pessimistic person who does not see the good in anything, or is like looking at all the worst calamitous things about everything. So this may not be a sign of depression, but if it continues and if it is affecting the person's life in more ways than one, what we call as a like person's occupational or social functioning is being affected in a very big way because of this feature, then this needs to be evaluated further. I won't call it
Right.
depression right away, but this needs to be evaluated. Depression
Okay.
is the same in all genders. There is no difference. Unfortunately or fortunately, it does not know differences in gender. So the effect and the suffering is the same in both genders, but there may be a difference in how each person handles it. Because sometimes it is expected that men handle things in a different way, women handle things in a different way. So there may be some ways in which the whole suffering is handled. So sometimes they may not come forward because I'm a man, I'm the breadwinner for the family, I should not be feeling depressed. So that may be a difference there. A woman is expected to take all the burden of the family in some way or one way or the other. So there may be a difference in how that is handled. But in terms of how it affects a person, how it makes a person suffer, there is no difference. We are talking about women here. There can be changes to the women's hormonal status when the woman attains menarche, that is when the girl comes of age, as we call it generally. Then when the woman is going through menopause, when your menses is going to stop, when the woman is going through pregnancy, initial phases of pregnancy, during pregnancy, post-pregnancy, when the woman is lactating or feeding the baby. These are some of the significant points in life, in a woman's life, where hormonal changes can interfere with your mood. So we have conditions like, I'm just going to touch on these. We have conditions called premenstrual tension or premenstrural depression. You can have perinatal or postnatal depression, wherein I mean that it can be during your pregnancy, anytime during your pregnancy, just immediately after your pregnancy, or even up to a year post pregnancy, and during your menopause. So these are like some of the periods of time when hormones can come into play and cause depression directly or indirectly. Other hormones which can interfere in mood will be thyroid hormone. Keep your health. You remember that this is part of your health process. It's part of your life journey. It's part of your life process. So one thing is to understand that this is not going to last forever. So that is one thing. The first and foremost thing to remember is that this is going to be another phase in life.
Right.
Then you also start taking care of your health. Make sure that you go for your regular checkups. You go for your regular medications if you're on any of them, and go and get a check with your gynecologist to make sure that you are not having any physical problems which could be contributing to your discomfort and pain, etc. Then the general tips will be like to keep in touch with people. Keep at least one or two people you can talk to, maybe like-minded people, maybe like friends or peers of similar age groups who may be going through the same problem or may have gone through the same problem. Get tips from them, get understanding from them as to what they did and what has helped. Sharing is important. Try not to keep it to yourself, because very often that's what Indian women do mostly. I'm very sorry to say that, but that's what many Indian women do. They think that their problems are their own and they should not be sharing with anybody. You can share with your spouse, if you have sisters or cousins, please share with them, or with friends or peers. I think now with WhatsApp, I think it's easier to share things, WhatsApp or Facebook or whatever. If it's okay to share some of these things, it's okay to come out and say that I'm feeling down today, I'm feeling like this today, so what should I be doing? So you actually, like, the moment you put a message like that, I did that once and I got like 100 messages within like half an hour. So it can happen. Then you also maybe pick up an additional, maybe I would say like an activity or a hobby. It's important to remember to keep your health good. Remember to pick up some form of exercise. It can be walking, running, swimming, dancing. I think now we have all this Pilates and aerobics, dance aerobics. Pick up something and keep active. That's important. Keep going out into the fresh air. Maybe not now because you're not allowed to go out, or you're advised not to go out. But you can still go for your walks. You can still go for a breath of fresh air. Maintain the social distance as a default. Listen to travel. Spend more time with your family. Spend time on cooking, and you eat healthy. That is very important.
Yeah. So I think just on that, I'd like to add that if you want, you can go to the PatientsEngage website. We do have content on menopause, but the important thing is to eat healthy, exercise, because your metabolism slows down. And one of the issues, especially for women, is they start to put on weight and then it makes you feel, kind of down and depressed. So increase your levels of exercise and eat healthy. And there are specific diets, not huge amount, but there are certain deficiencies you'll have, so you just need to make sure that you cater to that. And I think remember that the phase of perimenopause will pass, so you will get past that. It's time bound. So and keep checking with your doctor for sure.
Is kind of an assigned role to a woman, and I think if we are talking about the Indian context, I think a woman should get married, a woman should have a child, and she should feel proud that she's a mother and she should be taking care of the child. So that itself becomes a burden to the woman. She has done enough to be carrying the baby for 36 plus weeks. It's not an easy task to do. I think most of us know that. So there is a lot of expectation and pressure put on the woman when she is about to have a baby or when she has had a baby. So there are a lot of things which is very unfamiliar to the woman when she has her first child, especially,
Right.
and a lot of she puts on a lot of pressure on herself, a lot of self expectations that this is how I must be looking after my baby. I must be the best mother in the world. I think all of us think that we must be the best in everything. So this is one of those areas because a woman thinks that okay, I'm the only one who can deliver, I can have baby, so I must be the best mother in the world. I don't think there is anything called best mother in the world. You just be a good enough mother. That is enough. Even in the psychological viewpoint, we say that if you're a good enough mother, that is more than enough, and you can bring up a very good child. So
Mm.
now, because of that pressure, what happens is the woman can go through a lot of stress and anxiety during the pregnancy, and immediately after the pregnancy, we have what is known as the postnatal blues. I think it happens to 90 to 99% of the women immediately post pregnancy because you are physically drained. You have just had a baby. You have like really worked very hard. You have like run like 100 marathons at the same time, and you're physically drained, and you're mentally, psychologically quite strained. So
Mm.
that can cause a lot of irritability, some anger, some crying, and your hormones are also playing a bit there. And so you
Right.
can be crying, you can be having a bit of overprotection towards the baby, or sometimes there is a lot of indifference or nonchalance towards your baby in the initial month. It's usually the first 4 weeks post pregnancy, post delivery, but there can be things which can go on beyond that. So this can be displayed in the form of anger. Usually, it's the easiest target is the spouse. If he's sleeping while the baby is crying and you have to be feeding the baby at night, then you become like murderously angry towards the spouse. You can
Right.
have, you can, the next target will be the in-laws usually if you happen to live with them or if they have like fortunately or unfortunately decided to come and stay with you to help you through the childcare. So they become the next targets because they whatever they do, whatever they say is wrong. You are not going to listen to that because you've read a lot of self-help books. You have read, seen a lot of videos on how to look after your baby, and your mother-in-law is not doing the right thing. Your
Right.
father-in-law is not washing the bottles and the nipples correctly. They are not sterilizing them properly. So this again can be like an extension of the postnatal blues, but it can go beyond that. The person goes into a very classical clinical depression, which like we talked about earlier on, and
Mm.
the person loses sleep more than what they are expected to lose during the lactating period. Then they become not interested in eating. If they start losing interest in the baby, or they become too protective of the baby, they cling to the baby and carry the baby around. They won't let anyone touch the baby. They become angry towards people who try to talk to them. Even their own parents, mothers become enemies to them. And you see a full classic symptoms of depression. And there is a high risk there because the woman can become suicidal. And when they are suicidal, they can think of taking the baby along with them. So it becomes even more dangerous there. So that is one of the classical things which we worry about in postnatal depression.
Okay.
So again, the family service centers, they're open to everybody, not just a Singaporean or a permanent resident, even someone who is on a long-term pass or a foreigner can walk in and receive our assistance.
Mm.
So that is not an issue. They can give a call to the number that we have. It's a ComCare number, 1-800 number, which I think will flash later, and they can
Right.
come in and what. Effectiveness is something that's quite subjective, Aparna. I think it depends also on the individual,
Right.
especially for folks who maybe sometimes have gone to several different therapists and then decided, okay, this works for me or this doesn't work for me or this and all that kind of, it really is subjective in that sense. There are times where folks would think that when I'll give you an example of someone who's maybe going through a marital situation, and
Mm.
I think the end result is they decided to go separate ways. And
Mm.
the immediate reaction is, oh, the counselor did a bad job, and that's why they're
Mm.
separating. Whereas the couple may say, no, I think this is the best thing for us right now, at least
Right.
we can carry on with our lives. So it's quite subjective to say whether it's effective or not. I think it's a partnership that the therapist and the client, or as we call them, take together. They journey together. They
Mm.
definitely are going to be very mindful and share what their goals are, what do they want to get out of it. And the
Right.
therapist in the very beginning will say, is this a possibility that I can do or I cannot do? And maybe if I'm not the one for you, then I think, I'll refer you somewhere else. I think we're very transparent in that nature of it, rather than dragging it on with the client. So
Right.
in that regard, it's quite subjective to say how effectiveness.
Yeah, and I think you're right. I mean, even we found in our conversations with multiple people is that it's it's not about the quality so much. It's just about the equation that you're able to develop with the therapist, especially for counseling and kind of therapy.
Right.
So
It's a relationship. I mean, when we look at our literature in social work and counseling, it's 40% of it is attributed to the relationship that's built between the two of us,
right,
or maybe the family and the therapist. And then based on that, everything else falls into place, the intervention that you want to do. So it's very much that's an area that we try to focus on first. We're
right.
very humbled as folks come in. Within 10 minutes of not knowing you, the entire
Mm,
life story is shared. And we're
mm.
very humbled that they've taken that step to come in and see us. And we take this job seriously, to want to be able to say, okay, we'll do our best to help you as well. This is a perennial issue. We hear this, we hear this quite often. It really depends on what the issue is, and why the parent or the guardian of the child wants the person to see the counselor. I think it needs to be transparent to the teenager why the counselor is coming into the picture.
Mm,
Um, I think that's sometimes, the talk among teenagers are counselors are going to scold, they're going to preach, they're going to, let out all the information that you tell the counselor to the parent or the guardian. So there's no confidentiality and whatnot. So it becomes, I think, a more this against them kind of a thing, rather than let's help out the teenager. So we normally, parents do come and say, I want to bring my teenager, but they refuse to come. And
mm,
we do say, well, what you could also do is you can encourage your teenager to give us a call on the phone. We could
mm.
speak to them and allay their fears, allay any concerns they have. They don't need to see us face to face. They could do that on the phone first. We
Right.
have that option at the FSC. Or there's also cyber counseling that takes place in Singapore now for youth, quite a bit of
Mm,
it. So
mm,
there's touch points where the teenager can go in and receive the counseling, and whatnot. But I think what the guardian or the parent can definitely do is put on the table all the options that are available
mm.
in the country, whether it's a digital social media kind or face to face, and tell the teenager, look, these are what's available. This is what's going to, help you. Let's try it. Let's give it a shot, rather than forcing the person, because we all know, regardless of age, forcing someone to go for counseling is not going to help. Um,
Correct. Correct.
Intrinsically, they need to want to come and get the help. But if you do force them and say, no, I'm taking you for counseling, half the battle is lost already. So,
Yeah.
and this is
Yeah.
regardless of age. So we do encourage them to be very transparent. We've also shared with folks to show them YouTube videos of what counseling is about.
Ah,
Because I think,
okay.
right, again, that mindset somehow or other, among the population group, is the counselor is just going to scold, which is not the way. Or we don't make decisions for the clients as well. I mean, we
Mm,
throw out options and we say, here, do your best to make the right decision, but you've got to make the decision, not us. So
correct.
it's a lot of problem solving as well. So we see it in that way, in that regard as well, to teach them.
Yeah.
Yeah. Right.
So I think again, yeah, what we've also found is that there are a lot of, in a sense, misconceptions of what counseling will be. So in some cases, they're expecting clear guidelines to follow, and they're
Mm.
not. And they sometimes it's also a case where people expect it to happen in like one meeting or
Yes.
two meetings. So there is, there isn't that awareness.
Right.
And then, of course, there is this, lying down on the sofa kind of thing that you've seen in movies, which people expect that. So I
Yes.
think there is still a lot of misconceptions about what counseling is. But I think it's good to know that there are cyber counseling options, and you have these YouTube videos that explain what it does.
So when an individual does come in, they've got two ways of coming in. They can come in on their own, or they can come in with a family member or a friend. right? And so after we've assessed what the problem type is, and what help they need and all that, we do seek their consent, and say, would you be okay if we also involve family members, especially after we've assessed it that it is a family sort of situation that's causing this person to have this concerns or this issue that they're facing, and only if they give us the permission, then we involve the family. But once permission is granted, we call them family up, we explain the situation, we invite them down. Of course, we're never successful 100% to get all family members to come. Some of them will, they've got scenarios where some of you say, oh good, you take over now and you handle it and never ever call me back again. Or some of them are genuinely like, we'll be there in 5 minutes. We're very happy that our family members decided to come in and seek help. So it can go in either direction. But one of the things we do share with the families when they do come in is, we're not here to take sides. We're here to be quite objective, and then to see what can we do to resolve the sort of be a moderator in that way as well, to resolve the concerns that they have and whatnot. And sometimes these issues that they've come to see us have been deep rooted, seeded for about 20 years, 30 years ago kind of thing. Sometimes it's from the day they got married, on the day of the wedding itself, something happened and that's caused the problem all the way. So we take it as far as back there and we try to work with it. And that's why I am very appreciative you shared the thing earlier, Aparna, where you said sometimes instant gratification, I come today, you solve it today, but you've been having this problem for 20 years.
Right.
You've coped for 20 years and now you can't cope, but you're coming for the help. We're happy to help, but also allow us to journeying with you to manage it and whatnot. And also family members are important because earlier on when Dr. Nigila said, depression, the most severe situations is the possibility of suicidal ideation, self-harm as well. We want to be able to be in touch with the family to be able to ensure the safety, because these are risk issues, safety issues. So at least the family members can also keep an eye, and also provide support to this individual, which is important before the so-called formal intervention comes into place and whatnot as well.
Shared, it is important that the family comes in at the earliest possible. They understand that the person is going through some difficulty, because very often families dismiss it and say that, oh, this is just you're just making things out of nothing, and you should be coming out of it. That's nothing called depression. So I think it is important for families to understand. So we usually make an effort to get families down, at least the immediate next of kin, to come down to explain things to them, for them to understand what the person is going through, and for them to at least be supportive. If they're not able to contribute much, even if they're not able to monitor, supervise the person, at least be there, or maybe not criticize the person for going through this difficult phase, because very often you find that the family members become very critical. They start blaming the person for not being able to work, for not being able to do the usual routine things. So we try to get the families. So it's like recruiting the families early in the phase of the person's illness, or whenever the person has come to us for help. That is important. And also for the person themselves, we often tell them, like what Sujata shared. It is like, okay, this is a problem that has happened to me, so I have to get out of it. I think she shared this very nicely, because it is important to know that this is a problem, that this has to be solved. If the whole world is going to be against me, I have to get out of it. I have to do this for myself. That is important. So I think this is my favorite actually. I always try to tell people, always try to have what is known as me time. It's important to have some me time for yourself. I think we are all caught up in a lot of things. We are all very busy. We are all committed to our work, and we manage our families. We are all like super women. Yes, yeah, we are very good at doing all that, but we are very good at neglecting ourselves also. So I think what we have to remember is that having that, maybe that kind of private time for yourself, having that time called me time. So I say it can be maybe every day. You can't really do it every day. It can be the time you do your exercise, you listen to your music, your headphones on, sit in a corner and listen to music, your sleep time, your beauty sleep. which you have to tell your family, this is my sleep time, you cannot disturb me, you cannot wake me up. The morning when you sit with your coffee, you I mean, there are some jokes around, there are some cartoons which say that, okay, it depends on the level of coffee in your cup. So if it is full, nobody come and touch me, nobody talk to me. If it is half, maybe you can start a conversation with me. When I'm finishing my coffee, that's when you can start talking to me,
Right.
and I'm ready
Right.
to go. So that kind of me time. Okay, sometimes you can steal your time. You can do something guilty. It's okay. You go for your ice cream, for your chocolate. Maybe go for a show on your own. Go meet with your friends. Go for your drinks if you like. Have some
Right.
time. So I would say at least once or twice a month. You may not be able to do it more often. It's okay. At least once or twice a month. But you tell yourself you're doing it for yourself. This is your time,
Right.
your me time,
Right.
and I'm going
Right.
to enjoy this for myself.
But
Yeah.
I think we've been in the sector for a few years already. And
Yeah.
there's this concept that always comes is this me time thing is a very Western concept. It is
Right.
not something that Asians or the Easterners sort of follow through. What is this me time thing? Your family
Yeah.
is your time and all that. But I think of
Right.
late we've seen awareness. We've seen folks say, look, we do need to have that little bit of take care and self care. It's called. And self care doesn't mean you sit in a bathtub and have the music playing and candlelight. It could just mean
Correct.
I just need to be completely away from everything and just sit down and relax, kind of a thing.
Right.
Yeah. So one of the things I would want to share that across the board, this depression doesn't see skin color, it doesn't see the gender, as Dr. Nikhila put it well across. Depression doesn't know who it's coming to and whatnot.
Right.
Everybody, is accessible to it, and it's about saying let's get the relevant help for it. I think that's the more important thing.
Yeah, I think spirituality has been a very major recovery factor for me. The faith in God and the faith that He has His canopy of protection over me has really helped me get the courage to face my life with a different lens, so as to say. And I joined an organization called Brahma Kumaris, and the meditation and the knowledge that they imparted to me, I really think that made me a stronger person. And my ability to handle people and situations has drastically improved. I think it's very important to have a set timetable every day. Every day when you wake up, you must have at least a couple of things to look forward to. It can be as simple as catching up with a friend over coffee, or going to gym, or getting a new certification, or just as simple as reading a book. And I think if you have an active lifestyle, you have to tell yourself, okay, even if I'm not feeling well, I'm going to do these tasks every day. And you need to win over your mind. I think that's very important, because your mind will tell you that you're unwell, you're sick, it's okay to rest. But you have to tell your mind that no, I'm going to go ahead with these things, and then soon you will forget about your condition and you will recover.
Even something as basic as getting out of bed and having a shower, kind of gets you going. So I think routines are definitely very important. And also, and I think this is where I'll again bring you back in. I think it's also important to bring the family into support. For instance, I know somebody who said that they had tasked their spouse or child to ensure that they get out of bed. And even if they were in a different city, the person would call and say, get out of bed.
Depression does not go away by itself. you if it goes away, it's because you have done something like what Sujata did. She put in a lot of effort for that. You can't wish it away. You can't wish that, oh, I just blow wind in the air and it goes away. You have to blow wind in the air to let it go away. Yeah. So it's not a whiff of flake or snow. You have to do something about it. I think what I really like what Sujata was sharing. She put in a lot of effort, she understood that she was going through some difficulty. She tried her own ways, going through exercise, going through yoga, meditation, whatever method she knew, and listening to people. And she tried her ways and then thought that, okay, this is not helping me, so let me go for a proper professional help. I think that's the right way to go. Yeah, depression or any illness does not just go away.
Unless you address the root cause, you're just giving symptomatic treatment. So even your counseling or whatever will not kind of resolve it if you don't address the root cause, or at least identify. You can't maybe address it, but it may still be important to identify it so that you can come to terms with it or whatever it is.
I think it is, yeah, it is very important to know the root cause, or what we call as the main reason for the stress for the person, because stress is like the root cause for all the problems, for any kind of illness, or I would say even the physical or mental illness. Stress is the main reason. And when I'm talking about stress, it can be physical stress, it can be psychological stress, it can be emotional stress, it can be bodily stress in any form. So when we want to understand the root cause, it's by questioning. We go into we try to understand the person's life as a whole. We try to understand what are the factors which could be contributing to this person's life being suddenly in a jeopardy. The person has been like having a good job, having a good family. Why did this happen to them? And very often, some people are able to tell you very correctly. They are able to pinpoint and say, this is something that happened after I changed job. This is something that happened after I moved house from this place to this place. This is something that happened after my child left home, or my loved one left me. So these are the life events that happen. Small life events, big life events. So that is important to understand. But there are often situations where you're not able to identify the root cause, or the main trigger that started the problem. For such people, we try to treat them, try to go deeper as we get to understand them over a period of time, because we don't treat depression, or we don't do like what counseling we don't do in a day's time. We don't do treat depression in a day. It goes on for months, it goes on for a period of time. During the journey, we try to understand, okay, so what do you think was different then, and what do you think is different now for you? What has been the difference in life for you? What kind of person were you then, and what kind of person are you now? So there are, I mean, sometimes you have to pick up those very subtle, very very difficult signs and symptoms sometimes to pick up the main triggers. If a person is able to tell you the main trigger, great. Then you try to address that first, and then we treat the depression, which is most likely an expression of that distress they are going through. So it is possible to help this person. Yeah. So psychological help, therapy helps there, because this sometimes can go into the deeper aspects of understanding the person's main triggers, which can be contributing to the depression.
So one of the things that we do, or at least I come from a personal viewpoint here, when I do start the counseling with my client, I also talk to them on the very first day about termination, because I say to them that we do need to look at long-term goals and short-term goals, and we do need to see what we want to see as an outcome coming out of this. It would not be fair to them for me to just be there for the rest of their lives. I'm not doing my job properly then. So when we talk about the goals, at least it gives us something to work towards to see whether we are achieving those goals, right? But we don't want to put a hard and fast thing and say, oh, it's like in the commercial sector, you just get my KPI done. It's not like that. Along this journey, there are going to be roller coaster situations that could cause the counseling to go in a right trajectory. It could also cause a situation where the person being counseled says, look, I need to stop now. I don't want to come. I need a break from you. I'll come back in a few months. So, we want to allow all that to happen. The more important thing is to be able to say that we are here for you, and we want to see how we can help. So, but having the goals, it allows us to review as well whether we are heading in the right direction. So normally we would say, look, in 6 months, let's review and see how things are. And if it's not going according to plan, then let's review. Let's reestablish whether we need to come up with better goals, other goals, or whether we need to move into a different direction altogether. So
Right.
yeah, and the thing is, we also say that even if we stop the counselling for whatever reason, the doors are still open for you to come back anytime. Yeah.
And I guess we went through 1 hour, 15 minutes without a COVID-19 question, but now we do have one.
So maybe this is one of the contributing factors, like I was just mentioning. I don't know if anybody is getting depressed because of COVID-19, but if there is a person who's already known to have depression and is also suffering from COVID-19 now, the treatment continues as it's like life goes on as usual. COVID-19 gets its treatment as appropriate. It's usually symptomatic treatment, and depression continues its treatment. The therapist and the doctor continue the treatment. I don't think there have been any reports of any cross interactions between the medications used for COVID as well as for depression. Generally, antidepressant medications are quite safe with most of the medications used for other general medical conditions. So I don't think I'll treat it any differently. I think there may be a lot more anxiety about it, like in any medical condition, any physical condition. A person who is depressed already or is suffering a physical condition for the first time may become very, very anxious. So I think
Right.
a lot of support, a lot of reassurance, a lot of guidance will help the person. So that's how we will be helping people with depression.
And I guess the other issue that may be impacting mental health would be social isolation that may be there, right? And if you anyway live alone, or you live as, say, an elderly couple or whatever, then does that contribute to greater anxiety or greater depression? And what should they do about it?
It is likely that the anxiety may worsen, especially if the person has to be alone. And as we all know, this is something new for the whole world, for all of us, this COVID-19 situation. So we do not know the exact outcome of the condition itself. So there will be a lot of anxiety about it. So there can be the general health anxiety together with that the fear of the unknown will be there. So I think it's not that you're completely alone. Maybe you're not able to meet your loved ones and family members. If you're well enough to talk, you can still talk to them on the phone and keep in contact. Your loved ones can send you text messages. You can read them when you're not sleeping or resting. And you still have the healthcare workers, the whole team of the healthcare workers are still around you. You can talk to them. Maybe they don't have much time to stand by you and talk because they are like overwhelmed. But what I saw interestingly yesterday on CNN was the mayor of New York was talking. It was like past midnight, so I just got a glimpse of it. He was talking about actually getting professionals helping people during this phase of difficult times. They are trying to make phone calls to these people who are sick and are in hospital and are alone for all practical purposes. So they are actually recruiting many people, volunteers, and some of them are trained mental health professionals. Some of them are volunteers. They're trying to get them to talk to these people, send them text messages, and also keeping in touch with their families, because the families are also going to be extremely anxious because their
Correct.
loved one is in hospital. They do not know what is happening there. So
Right.
and the doctors and nurses may not be able to provide updates as and when it is required. So these mental health professionals or these volunteers are actually trying to help a lot. So I think the basic thing there is the support, being
Right.
being there, being able to understand. But we ourselves are trying to grapple with the situation. So we are trying to do as best as we can. Yeah, so support for each other is the most important thing. I would just say that, yeah, depression is classified as an illness, as a mental illness, but it is not taboo to have it. All of us are prone for it at any point of time in our lives. So I think it is, if you feel that you may be needing help, don't feel shy, don't feel embarrassed, don't feel worried that others will know about what you're going through. Come forward, seek help. Help is always available. Hope is always available.
The hope that everyone who needs that help will just come forward, and we'll do our best. I think, again, the journey is about partnering one another and doing the best for one another.
My last message before we end is when I decided to take complete charge of my recovery, that's when I recovered significantly and felt a sense of pride. Because still you're dependent on others, you will always have expectations failing. Not to say that you can't seek support, but I think you yourself are the biggest support to yourself. Thank you.
Wonderful.
Right. So thank you, Sujata. I think you again reiterate why it's important to learn from lived experiences of people. And I think it's important that all of us know that there is great value in learning from others' experiences, but also then figuring out what works for you. And as Dr. Nigila said, accept your condition, seek help, seek support. There is a lot more available now than there was a few years back, but you do have to take that step. So yeah, let's move together on this journey of emotional and mental well-being. Thank you, everyone. Start with a quick introduction of PatientsEngage. It's an online platform operational for 5 years. We are very focused on holistic and evidence-based management of chronic conditions, including mental health of people, both from the perspective of patients, family caregivers, as well as how to manage and prevent these conditions. We believe very strongly in the value of lived experiences and how being engaged and proactive with your own health leads to being empowered and leads to better quality of life. We've been doing these monthly webinars for about 18 months.
Club2Care is a volunteer-driven, community-based mental health organization. What we have aimed to do is to raise awareness of mental health and mental wellness and to provide these to people in need. So what we have been providing is counseling services, we do interactive talks, we do community outreach, and we do community screening also.